During my JJ hospital days, I was really exposed to two extremes of patients. And one hand, I saw young women, who were coming to me and who didn't want the baby. And on the other hand, the young women who wanted baby. They were such distressed couples, and they had tried for years, and they could not conceive, and they were losing hope. So these girls who wanted unwanted pregnancies were so cool. So I really thought that. I should really get into this line where I can help these distressed couple. One particular couple actually changed my life. They had been married for 12 years. The woman had undergone multiple treatments without success. When I examined her, I found that that was tubal block and something that could potentially be addressed actually through IVF. The pain in her eyes was not just medical. It was social, emotional, and deeply personal. And that day I realized that, infertility is not a biological condition. Actually, it's a social disease in India. And I decided then and there that I would dedicate myself to reproductive medicine, not just create pregnancies, but also to restore dignity, confidence, and hope. That case actually, which I touched, that woman touched me in such a way that she crystallized my path towards IVF. And 35 years later, the same emotion actually continues to drive me. My internal checklist before adopting any new technology at Bloom IVF uh, is at Bloom IVF, we have introduced several firsts in India. ICSI, egg freezing, ovarian tissue preservation, AI based embryo selection. But one thing I must tell you, I never adopt a technology because it's new. I adopt it because it's necessary. My internal checklist has actually three pillars. The first one is evidence. Is there evidence? Is there data? Are there live birth rates improved? Is it reproducible? I think that's very important. Second, I'm always governed by ethics. Does this technology empower the patient? Is it transparent? Are we, overselling hope? In fertility, ethical balance is very critical. And third, of course, is economics. Can this technology be made a little affordable for Indian patients? My dream is accessible infertility care for all and not just the privileged few. So, technology must reduce the suffering, not increase the financial burden, and the balance guides every decision I take. And I think it's so, so important to be connected to the patient also. Then you realize that this particular technology will help that person. I still remember, a patient who had come to me. She had had two failures, and then we used the laser technology first and gave her twins. And, I was, 30 years old or 32 years old, and the 60-year-old father of hers, he was a general practitioner, and he came and he touched my feet when we delivered the babies. So that day, it made me realize that technology is needed to bring hope to a lot of patients, and it is used for difficult patients also. So I think it's definitely worth it. India has 17% infertility burden, yet our IVF cycles per capita are far lower than the developed nations. The barriers, they are multi layered. First of all, in our country is stigma. Infertility is still seen as a woman's fault. Though now there has been a change. 35 years ago, only the woman used to come. But now the couples come together. So I think there is a little bit of awareness, but the stigma still exists in a lot of places. Of course, late diagnosis. Couples wait 5 to 7 years before seeking help. And women come in their 40s, and if they had come to me when they were 30, they would probably have better results and with their own eggs. Of course, cost perception. Even though India is more affordable than the West, it still feels expensive for many families. But people should know that there are a lot of centers doing budget IVF, and there are government centers, centers in medical college like Dr. D.Y. Patil Medical College, where the treatment is really affordable. And the regulatory transition. The ARD and the Surrogacy Acts brought structure, but implementation gaps definitely remain. But the biggest barrier is awareness. Infertility is a medical condition, not a moral failure. Until society understands that, access will remain limited because people just don't come forward to accept it. My vision is that fertility care becomes as routine as diabetes care, early, structured, and stigma free. And I hope my dream comes true sooner rather than later. Yes, our growth has been more measured compared to aggressive chains, but that was a really conscious decision of ours. In fertility care, outcomes matter more than the footprint. Depth matters more than the density. Actually, each center, requires a highly trained embryology lab, quality control systems, emotional counseling infrastructure. Scaling rapidly without maintaining the standards can actually compromise success. And therefore, I have 11 centers over the last 30 years, but I think this is very important. But remember, in the next decade, I do see structured expansion through quality led partnerships and, of course, a strong training program. My legacy is not just clinics, it's people trained in ethical reproductive medicine. The ARD Act has brought much needed standardization, registration of clinics, documentation protocols, and accountability has really improved the patient safety. There is a major positive step in these acts. But however, the law sometimes moves slower than science. Areas that need further evolution, clarity in gamete donor regulations, more flexibility for single women, faster grievance redressal system, and also, the implementation, it takes time. Regulations must protect the patients, but also, enable our innovation responsibly. As someone involved in policy discussions, I as someone involved in policy discussions, I believe ongoing dialogue between clinicians and lawmakers is very, very essential. But I think this law has been very good for the country because it has brought ART under supervision in ethical practice, and especially the National Registry is really going to make a difference because we do so much work. The world needs to know about it, and they will start believing us because we now have a national registry and we're reporting to it. So I think it's going to give a big boost to Indian IVF fraternity that they are very good and comparable to the West. AI and embryo selection, human judgment versus machine AI does not replace human judgment. 1 minute, huh? This is question number 6. So I'm going to start talking about it now. Human judgment versus, say, machine AI, that does not replace human judgment at all. It augments it. In fact, in embryology, it's both science and art. AI provides pattern recognition through thousands of embryo images, something a human eye actually cannot do at scale. But final decisions are with the humans, they remain with the humans. I actually reassure patients by explaining that AI is a decision support tool, not a decision maker. Like, supposing you are the pilot of the flight and the co pilot is your AI. That's what I tell them. The doctor is the pilot and the co pilot is your AI. In one case, AI grading identified a morphologically average looking embryo with high implantation probability. We obviously transferred it, and the couple conceived after 4 failed cycles. So I think even though it was average looking, the the AI actually has a dynamic calculation and it tells us. So I think it's worth it. This reinforced actually my belief that technology must support experience and not substitute it. When couples come after multiple failed IVF cycles, I think I first do is I listen to them. I think, to give them empathy is very important. I actually look for three things. Emotional fatigue. Are they medically tired or emotionally broken? Second is, the lab quality indicators, where the previous stimulation protocols, embryo grading patterns, the lab environment. And of course, sometimes there's misdiagnosis also. Endometriosis, adenomyosis, thrombophilia, sperm DNA fragmentation, immunological problems also. Sometimes I do very small refinements and they can actually make the biggest difference. A customized, individualized stimulation, a better embryo selection. I do a hysteroscopy, and many times I've realized that correcting subtle uterine factors makes a lot of difference. So remember that any patient or who has infertility is rarely a one size fits all. It's all individualization, individualization, individualization. And the most important part is to show empathy and to troubleshoot what is the problem. And I always tell my patients there are 5 pillars which we must work together. One is exercise, one is a good diet and nutrition, one is meditation where you can calm down, your mental health and your sleep. All these 5 pillars actually contribute to giving you a good success. So very often I may have not done anything but just reassured the patient, and it definitely helps. What keeps me awake at night is delayed motherhood. I want it to be available to each and every person in my country. Women today are empowered professionally, which is wonderful. But ovarian biology does not change. Ovarian aging remains real. We must educate young women about fertility preservation without creating the fear. Like 30% of the girls would definitely conceive with a low AMH, but the 70% need help. So I think there is something that we can warn the girls about, that please try and have a baby early. And if that is not possible, then go do egg freezing. So without creating the fear, it's important to, sensitize girls. I think my legacy through Bloom IVF and my trainees should be, of course, ethical existence, accessibility of care, scientific rigor, and compassion led medicine. I think that is very, very important. Having an empathy. Even today, when I treat a patient, I think of the patient as my sister, my daughter, or my daughter in law. And that way, I'm able to give her the correct treatment. So, if future generations remember me, I want them to remember me not as just someone who created babies, but someone who created systems of hope. I think I will feel absolutely fulfilled and someone who gives empowerment to women. Happy Women's Day to all the wonderful women out there. And because of you, I think the world runs. Keep smiling, keep fighting, and do well.